For me, the biggest breakthrough has been the development of the highly effective CFTR modulators for people with cystic fibrosis. As a pediatric pulmonologist caring for people with CF for many years, I have been seeing how these treatments completely change the disease. It showed us the power of combining genetics, personalized medicine, translational research, and multidisciplinary care. In the past, we mainly treated complications in people with CF, like infections, poor growth, worsening lung disease. But today, many children are healthy, breathe better, spend much less time in the hospital with the IV treatments, and they can live much more normal lives. What changed my way of thinking is that we are no longer only treating symptoms, we are treating the cause of the disease itself. We also learn how important it is to start treatment early before permanent lung damage develops. However, we have to remember that the CFTR modulators are not in every country allowed for children because we know that these drugs are very, very expensive. Because every child deserves the best possible respiratory care no matter where they live. When experts from high income countries and low and middle income countries meet together, everyone learns from each other. Some centers bring advanced technology, new treatments, while others bring great clinical experience, creativity, and ways to work effectively, even when the resources are poor. These discussions help us to find practical solutions that can work in many different parts of the world and not only in large specialized hospitals or big centers. In pediatric pulmonology, many important problems like asthma, respiratory infections, bronchiectasis, smoking exposure, and more affect children everywhere. We can learn much more by working together. Meetings like INSPiRED create long-term collaborations, educational projects, and research partnerships. In the end, the biggest benefit is for all the children and families that we care for. What makes INSPiRED special is that it's not only about presenting science or technology, it's about building a community that works together in order to improve children's respiratory care, health around the world. Science, of course, is important, but it only makes a difference if we can use it in real practice. INSPiRED brings together professionals and international experts in the different disciplines from all over the world to share ideas and learn from each other. The Congress encourages practical learning, discussions, and even international collaborations from all over the countries. Through networking between different countries, we can share experience, we can discuss different clinical cases, complicated clinical cases, and we can together improve the care of the children. Another very important part of INSPiRED is the involvement of young professionals. I think this is an important point. It's completely different from other conferences. The meeting helps young pediatric pulmonologists create international connections very early in their career. And in the end, the goal is not only excellent science, but better care and better quality of life for children everywhere. I think this is a very, very difficult question to answer because one of the main strengths of INSPiRED is the diversity and the quality of the program. If someone could attend only one session, I would suggest probably two options. Either to choose a topic that is part of their daily clinical practice, or to do the opposite, to attend a session, for example, about a completely new topic to expand their horizons and to learn something completely different, for example. But honestly, knowing the program and how carefully every session was selected and each of the speakers for this conference, it's very difficult for me to choose only one, even for myself. As a participant, I would struggle to decide because the program includes so many excellent and inspired sessions. Collaborations between doctors and centers from different countries around the world are extremely important for advancing pediatric lung health. No single country or center has all the answers, of course. By working together, we can share knowledge, we can share research, clinical experience, and even different perspectives. Some countries may have access to advanced technologies and new therapies, for example, while others have a strong experience in managing different diseases with limited resources or different patient populations, for example. I think that these collaborations help improve education, research, and the patient care, of course. They also allow us to create international guidelines, protocols, to develop, for example, different multi-center studies between different countries, and to learn from each other's successes and challenges. This is one of the aims of the early morning meeting, for example, the special interest groups, to share experience and to do networking between people from all over the world. And so, in the end, collaboration between countries helps reduce a gap in the care of children, and it helps to improve outcomes for children everywhere. Pediatric respiratory medicine moves forward much faster when we work together globally. And this is, at the end, the idea of INSPiRED.